Hi, my name is Kim McCann. I'm a Senior Public Health Inspector with the Local Health Unit. Our Local Health Unit jurisdiction covers the Leeds, Grenville, and Lanark areas. So we're a fairly large health unit geographically. We go from Gananoque all the way over to Cardinal, up to Kemptville, and as far north as Pakenham, which would of course include Elmont and Carleton Place and Lanark Village in Perth and over to Westport. So that's really the jurisdiction that we cover as a health unit. Now I know you're hearing lots of news about cases within our region, and of course we do have cases within Leeds, Grenville, and Lanark. Now the majority of our cases are actually in long-term care. We have had some cases in the community, but not a huge amount. Really, the majority of our cases are within long-term care. And I just wanted to talk a little bit about COVID-19 and where we've come from and where we are now, and how we can get to the future. So going back to the new normal, as they say. So just a little bit of background, and you would really know this anyway, but on March the 17th was really when we started seeing, or I guess just prior to March the 17th is when we really started seeing community cases pop up in Ontario. And it was on March the 17th that our Premier, Doug Ford, announced or proclaimed a state of emergency within the province of Ontario because of COVID-19. And part of that was, part of that emergency order was ordering some non-essential workplaces to close. It also required some workplaces or allowed some workplaces to stay open, but had to work in a modified fashion. So for example, our restaurants had to close their seating areas, but could become a takeout or delivery service for food. So what we're seeing now, the other big thing, I guess, with that emergency order was restricting visitors to retirement homes and long-term care homes, and prevented employees from working in more than one home at a time, and that really was to prevent the spread of COVID-19 from home to home. The other thing that we know is from that emergency order is that the province has prohibited large gatherings. So at this point, and that's still current and has been extended, I believe now into June, around the 1st of June, of gatherings of no more than 5 people. Now, the one thing we know currently is that these requirements are changing on a day-to-day basis. So it is really important to watch Doug Ford's press announcements, read the province of Ontario's websites to get the proper information about what can operate and how you can operate. Things change on a daily basis and will continue to change on a daily basis. Hopefully things become looser and we can sort of get back to our new normal. It is important to know that, and really until we get a vaccine for COVID-19, there really will not be a normal like we saw last fall or last summer, or even in the past. We will probably, until we get a vaccine and an effective vaccine, we will have to keep up with some public health measures such as good social distancing and good hand hygiene. Those are 2 key public health measures that will prevent the spread of COVID-19. So currently we are entering stage 2 in what's called the framework for reopening our province, and this is a document that the government of Ontario produced, and it's in order to help businesses get back into business but yet prevent the spread and new cases of COVID-19. We're currently seeing our curve of COVID-19 flattening, and we'd like to keep it that way, so it's really important that we all do our part. And I know I'm talking to businesses, But it's not just businesses that need to do their part, it's the general public as well. We all collectively need to do our part in order to prevent any more cases or a spike in cases of COVID-19. So as the phases, or as businesses reopen, Public Health will be monitoring the number of cases, and we report local cases to the ministry on a daily basis. So the top doctors at the ministry will be monitoring the progression of the disease and determine whether or not we can move into more phases of the framework for reopening our province. And that will be usually within 2 to 4 weeks. So we hope that we get to move forward and not backwards. There is a good possibility that if we all don't do our part to keep cases low, that we will move backwards, where we may see more restrictions again. So how do we keep moving forward? We need to practice good public health measures. So we did create a document. It's a fact sheet. It's called Public Health Guidance for Businesses in Leeds, Grenville, and Lanark. And I just wanted to go through this document a little bit. One thing to know as your business is starting to open, the province has produced what they call sector-specific documents on, so the sector being the type of business. And if you go to their website and just in the search box, if you were to type in sector-specific guidance documents, you'll get a whole list, and they range from restaurants to takeout to grocery stores, so retail, construction sites. Any sector that you can imagine is pretty well listed there. Even golf courses, for example, and marinas are listed there as well. And in that document, or in those documents, you will find really good controls or expectations, I guess, on what the employee's responsibility is and also what the employer's responsibility is. So it really is a two-way street. It gives control methods in those documents. So I really encourage everyone to go and check out that sector-specific guidance documents on the Ontario website. They're excellent. So for the employer, really what we want to see is some, like I said, some basic public health processes being put into place. So number one is you want to ensure that your employees that are coming to work are well. So have them do a formal screening prior to coming into work. Again, on the Ontario website, there is a self-assessment tool that can be easily accessed. And what our employer has done is we're required to do that self-assessment prior to coming into work on a daily basis. So that's just one thing that can be done. If you find that your employees are not well, they should contact their healthcare provider. And also we do have assessment centers set up around the region where they may go and get tested for COVID-19. You also want to post signs on the doors of your business to notify that if they are sick, if the customer is sick, then not to come into your business. And we do have a poster. It's a safe shopping poster. I know it's more meant for retail, but these posters can be modified just to make them generic, and we're going to be working on that shortly at the health unit. We're actually putting together a task force to help get the word out and get resources out to our communities. So it's a basic poster just saying be safe if you're unsick or if you've traveled, and there is still some travel just with workers going across the border and whatnot, not to come into your business, asking people to have a friend or family do shopping for them. And you want to set up your environment in in a manner that will prevent the spread of COVID-19. So you want to set up your business environment. So first of all, maintaining or setting up in a manner to ensure that clients or customers are maintaining a 2 meter or 6 foot distance in between each other is very, very important. If you're finding that your space, so your store, for example, maybe it's a small Nook type store, if it's just too small to maintain that 6 foot distance in between customers, that's really when you would want to put a sign on your door to encourage mask use. We also on our website have signs that show mask use. So you could go to our website to get that. And our website is www.healthunit.org. And there's a COVID button right on the front page, and if you go there, you'll find a lot of resources. But really that 6 foot separation distance between customers and between your customer and the employees and yourself as the employer is very, very important. You want to monitor the number of people in your store. You want to make sure that you can, again, maintain that physical distance in between people. So, you may have to have somebody standing at the door sort of doing a head count as they come in. Or the other thing I've seen in other stores is that they've put restrictions on the stores and they put it right at the sign in front. So again, works well if you have a small store. You could put a sign up to say no more than 3 people or 5 people in the store at one time. And if you have open view of the store as you walk in, people can self-monitor that as well. But it's good to be vigilant of the people coming into your store, just so that you know that you're not going to have too many in at one time. A couple of other things you could do, or other things that people have done, is they've used markings on the floor, so in 6 foot intervals around the cash to keep people separated from one another. One-way flow of direction around the store. There's lots of stickers being produced right now, which is also helpful. So arrows, or you could just even use tape arrows to indicate the flow of your store to go. You could use staff to help direct the flow. If you do have a larger store, you may have to have staff placed in strategic areas where they can keep the flow moving. And what other stores have done is they've used PA systems to remind people of the 6 foot distance and to keep the flow of the store going. Now, in order to protect the worker, it's really advisable to have some sort of clear barrier at the cash registers or in any locations where the staff and clients may come into contact. That clear barrier is important because what it does is if somebody were to sneeze or cough, or just when you're speaking, of course, saliva comes out of your mouth sometimes inadvertently. It's a barrier to stop those droplets from actually reaching your employee. So it's a really good tool. A lot of people are using plexiglass. What you use really is up to you. It should just be clear, obviously, so that the customer and the employee or the employer can see one another. But it also has to be of a material that is cleanable, cleaning where you can clean and disinfect the material. So I was in a store, it's a small store, recently, and what they did was their cash register, they just have a single cash register and it's not a very large space, but what they did was really sort of unique. They took a windshield from a snowmobile or a four-wheeler, and they were able to put that onto their countertop, and it created the perfect barrier for them. And again, it's clear, it's something that's cleanable and something that you can disinfect. So it worked, it did the trick. So I thought that was really smart. Now, the one thing I wanted to mention too was that the Ministry of Health, along with our local economic development people, and probably the GAN Economic Development website may have this link on it, but they've come up with supply lists for personal protective equipment. And I was looking at the one yesterday that the Leeds Grenville Economic Development Committee did. So it's at the United Counties. They actually have a list of suppliers, local suppliers that can supply different types of personal protective equipment, and those barriers are one thing that is on the list. The province of Ontario has also created a workplace supplier list. So again, in that search bar, if you were to search workplace PPE supplier directory, you'll get to the Ontario site or the supply list. For the United Counties of Leeds and Grenville, go on to their website. And if you were to look up local PPE supplier in their search bar, you should come up with this list. It's also, we'll also revise, these are relatively new links, so they're not actually in this fact sheet, but we will revise this fact sheet. We're meeting today to do that. So we'll make sure we get these links in that fact sheet to help. So a few other things that the employer would want to do is, if you do use vehicles for your place of business, consider your vehicle. Is it possible to put plexiglass up? So for example, a cab company may want to put some sort of clear barrier, such as plexiglass. It could be something else too, whatever works, in between the front seat and the back seat. If you're another type of vehicle where you may need to have two people, but it's a personal vehicle that you're using and you don't want to put the plexiglass up, consider, the driver in the front and a passenger in the back. It's not exactly 6 feet, but at least it will create some sort of space. Again, in those small spaces, this is where a mask would be valuable as well for the employees. Consider staggering your employee schedule and breaks, including lunches, so that you don't have too many people in the lunchroom or in the break room at one time. Consider employees working from home. Many of us have started working from home, and it seems to be working out. So if it works out for your business, then maybe that's something you would want to consider going forward. It's not ideal for all workplaces. So it really is up to you and your company. Again, with storefronts, have an in and an outdoor so that you don't get that congestion of shoppers. Really encourage the use of debit or e-transfer or credit cards, just to minimize, again, the amount of handling of money. As we know, money is very dirty, and we know that the COVID-19 virus can survive on things such as money for a very long time, for a couple of days anyway. Johns Hopkins University recently did a study and found that COVID-19 can last on cardboard for up to anywhere between 12 and 24 hours, but on hard surfaces can last up to 3 days. So, anything that we can do to reduce touching surfaces that may be contaminated with COVID-19 would be of value. Maintain your online and telephone ordering service. People are starting to get used to that, and maybe it's suitable for your business. The one thing I wanted to mention is that no two businesses are alike. Every business is unique. So you really have to sort of take a look at your business and decide, what controls can I put in place that suit my business best. The workers themselves, again, before they come to work, they should do that assessment, health assessment, that health check, to make sure that they are free of symptoms of COVID-19. If they are sick, they should stay home. And then again, contact your healthcare provider, and we do have assessment centers within the area that they can attend to be tested for COVID-19. And then just ensure that you've educated your employees on all of the prevention methods that you've put in place, and that they're adhering to the good practices that you've put in place as an employer. The public too has a large stake. This really is a collective effort between the employee, the employer, and the public. You've put these measures in place to help protect the public, but not just the public, yourself and your employees as well. So you really need to encourage the public to adhere to that. Again, making sure that they're keeping the 6 feet apart from each other, asking them not to come into your workplace if they are sick or symptomatic. And of course, encourage great hand hygiene. Unfortunately, as much as we say don't touch your face or, don't sneeze into your hands, things happen. So the hand hygiene is key in all of this. So having good hand washing facilities or even hand sanitizer throughout your store is very, very smart. I know myself, I suffer from allergies, so from time to time I get really itchy nose or itchy eyes or itchy ears, or that sneeze just happens to sneak up on me, and it's not that I mean to, but it comes out from time to time. And with those things that do happen, that's where hand sanitizer is key. And also we're being encouraged to wear cloth face coverings now. We don't want to use, as the public, we don't want to use the surgical masks. We want to ensure that those are kept for our hospitals. But we want to protect others from us and our droplets that are coming out of our mouths. So cloth face coverings or face shields are a great solution to help protect others. So again, the government of Ontario, as well as the federal government, is encouraging face cloth coverings. There's lots of good patterns on the web that you can easily get. There's lots of local companies as well that are making masks, sewing masks for us. So if you see one in the store, help support another local company and buy one of their masks. The thing about masks is you just want to make sure that whatever the material that the mask is made out of is actually going to prevent the droplets from getting out of the mask. So you want to make sure the cloth itself is solid. If there's holes in the cloth, not an ideal use of a mask. So the one thing about masks is after you wear the mask, that material will become wet. You can wash them in the washing machine and in the dryer. The heat of the wash water plus the heat of the dryer will kill the virus. So please do wash them. Have a few on hand throughout the day. So if it does become soiled or wet, then it's a good time to change your mask. Again, when you're wearing a mask, make sure that you are practicing good hygiene. We do have to take the masks off. And from time to time you may get an itch. So it's really important to practice good hand hygiene. Just make sure that the face mask itself fits well around your nose and mouth. And try to avoid touching the mask as much as possible. Don't forget, we're sneezing and coughing and talking into those masks, so they will become wet. They will get saliva on them. And if we're touching the mask and then touching surfaces without practicing, without washing our hands or without using a hand sanitizer, we can actually transmit our germs from our face onto a surface. And then again, change the mask as it gets wet or if it becomes dirty. So if you have a big sneeze or cough, then definitely, even if your mask isn't wet, at that point you would want to change your mask. So the other thing I wanted to touch on too was the use of gloves, because we see a lot of people using gloves thinking that it's a good protective barrier. Gloves will not replace hand washing by any means. Hand washing and hand sanitizing is one of the most effective methods of protecting ourselves and protecting others from COVID-19. Before you put a glove on, if you do have to wear gloves, maybe you have a cut on your hand or a bandage or some sort of wound on your hand that you need to have it covered, that would be an ideal time to wear gloves. But before you put a glove on, make sure you wash your hands first. Gloves really are considered single use. So for example, if you are handling money, you need to change your gloves before you move on to another task. If you're on the cash register, you need to change your gloves before you move on to another task. We can't have, and this is unfortunately the problem with gloves, is it creates a barrier between your hand and whatever item you're touching. So it can easily become a vehicle to transmit bacteria from the glove to the new item that you're touching. And because we're not feeling it with our hands, we tend not to wash and sanitize our hands enough. So the gloves can actually be a mode of transmission of bacteria and viruses from one surface to another, because we're not cleaning our hands in between. So it really is a last resort as a personal protective equipment. And again, if you're wearing gloves, they really are a single task personal protective equipment, piece of personal protective equipment, and your hands need to be washed in between using the gloves. I've seen a few times where, somebody will get out of a vehicle and they've driven around town with their gloves on. They get out, they go into the store, they've had to open the door, then they're going into maybe a grocery store or another type of store and touching items there. So really what they've done is they've just transferred bacteria and viruses from one surface to another throughout their travel. So that's how gloves can be misused. So it's really important to just remember that if you have to wear a glove, it's a single item only, and wash your hands before you move on to the next item. So just getting back to masks a little bit, like I said, the government is starting to encourage us to wear masks, and you really would want to wear those in areas where the space is small. So like we talked about before, possibly in a taxi cab would be a good place to wear a mask. In small stores would be a good place to mask. If you're receiving some sort of service, so currently now medical practitioners are open for emergency services or urgent care services, so that would be a good place to wear a mask because you're so close to the person actually providing the service. So that would be a good time to wear a mask. We do have some videos on our website on how to wear a mask. It's really important to know how to wear a mask. So I would encourage you to go to our health unit website to find out how to properly wear a mask, and to train your employees as well on how to wear a mask. I was at one center not long ago, and somebody was wearing a mask, and they thought they took their mask off properly, and then they took the mask and hung it over the doorknob. Well, that moist mask that person was wearing has now just contaminated that door. So it's really important to know how to wear a mask and to know how to dispose of a mask after it's being used. Again, with hand hygiene, we have some good videos in this document, both for masks and videos, or mask and hand hygiene. You can find some links in this document that will help you know how to properly wash your hands, and hopefully that will prevent the spread of COVID-19. So again, it's important to train your employees. So that's pretty well all I have to say. We do have a few resources at the health unit. This is another one you've probably seen around town quite a bit, but we do have these. They're all printable from the health unit, these different signs. You can get them off our website. And also just around cleaning and disinfecting, we do have this great fact sheet on cleaning and disinfecting that was produced by the Ministry of Health. The one thing about cleaning and disinfecting is you always need to clean the surface before you disinfect. You need to get that grime off in order for the disinfectant to be effective. And then remember to clean areas, commonly touched areas, at least every 2 hours. If you have a public washroom that people are using, you monitor that public washroom. It likely may need to be cleaned more than every 2 hours. So you know your business best. You know that washroom may need to be cleaned every 15 minutes, or it may be every 2 hours. So you know your business best. So you can gauge that for yourself. But it is important to clean commonly touched areas such as doorknobs, such as light switches, the faucets on the sink, the flusher on the toilet. Don't forget those places as well when you're doing your cleaning and disinfecting. And then again, on this fact sheet, it gives some ideas of good cleaning products and good disinfecting products. A cleaning product won't necessarily kill bacteria and viruses, it just cleans the surface. A disinfectant is what you need in order to actually clean and sanitize, or to clean, or I guess to kill, I should say, germs and such as bacteria and viruses. And be sure to follow the manufacturer's instructions. Some surfaces with the disinfectant would have to stay wet for at least 45 seconds, some up to 5 minutes and some up to 10 minutes. So it's really important to read the manufacturer's instructions to ensure that you're getting a good disinfected area. If you want to learn more about COVID-19 itself, please go to our website, the Health Unit website, healthunit.org is our address. You'll find lots of information there on COVID-19, and like I said earlier, we are developing a toolkit for businesses as they reopen. So hopefully you'll be able to take advantage of that, and I hope that this information was helpful to you.